Good morning. This is Akashvani Kohima. The morning news read by Jonas Yantan. Prime Minister Narendra Modi will leave for a visit to South Africa and Greece today. Foreign Secretary Vinay Mohan Quatra said the Prime Minister will depart for Johannesburg, where he will participate in the 15th BRICS summit that starts today. He informed that Modi will participate in the BRICS leaders' retreat, where discussions are expected on global developments of concern. Quatra added that on Wednesday, Prime Minister will participate in the BRICS summit, which will focus on intra-BRICS cooperation, reform of the multilateral system, and counter-terrorism. The Foreign Secretary further informed that on the 24th, the Prime Minister will attend BRICS Africa Outreach and BRICS Plus Dialogue. In view of the recent reports of the detection of certain newer variants of SARS-CoV-2 virus reported globally, Principal Secretary to Prime Minister Dr. P.K. Mishra yesterday chaired a high-level meeting to review the global and national COVID-19 situation. An overview of the global COVID-19 situation was given by Secretary Health, including certain newer variants of SARS-CoV-2 virus. After detailed deliberations, Dr. P.K. Mishra highlighted that the COVID-19 situation in the country remains stable and public health systems in the country remain geared up. Mishra stressed that there is a need for states to monitor trends of influenza-like illnesses and severe acute respiratory infections cases, send sufficient samples for testing of COVID-19, and maintain a close watch on the new global variants. Following the spike in dengue and conjunctivitis cases in Mon Town, Minister for Health and Family Welfare, P. Paiwang Konyak, yesterday rushed to Mon to take stock of the situation. Accompanied by DC, SP, CMO, MS, and Konyak Civil Society's Mon, the Health Minister visited the District Hospital Mon and interacted with the patients. Expressing his concern over the surge of dengue, Paiwang directed the medical officers and staff to coordinate with the district administration, CSOs, and NGOs to disseminate information and awareness on dengue cases. The minister also instructed the department to submit a list of medical requirements in the district in order to tide over the present crisis. He said the department, district administration, police and community would discuss on alternative steps to further prevent the escalation of the disease to other parts of the district. Paiwang urged the civil societies to advocate the practice of blood donation to ensure availability of adequate blood for patients. Medical Superintendent of DH, Mon, Dr. Meren Inlam Sendem, in her brief report informed that till date, out of the total of 413 suspected dengue cases, 65 were reported positive in the district. Schools in Mon district will be closed from today till 26th of this month in view of the rising cases of conjunctivitis and to further contain the spread of the disease amongst the school-going children. This was decided in a review-cum-consultative meeting held between State Health Minister Paiwang Konyak, District Administration, police, medical staff, HODs, and civil societies. According to DPRO report, the minister sought the support of Assam Rifles, Red Cross, civil societies to usher assistance to the medical department in handling the situation. Concerning the war against drugs, he requested the district administration, police and NGOs to coordinate with one another before conducting checking in order to avoid any incidences that had occurred in Dizit and Woka. Further, the minister noted that any government employees under the influence of substance should be given 3 months' time to rehabilitate themselves. Paiwang further expressed concern over the incident of August 15 at Apui and said such an act should be condemned at the highest level. Deputy Commissioner Newland Sarah S. Jamie has ordered temporary suspension of physical classes in schools till 26th of this month. The order was issued in response to the increasing cases of conjunctivitis, commonly known as eye flu, in the district, particularly among school-going children. The DC said the suspension of physical classes was decided after thorough deliberation with officials from the Department of Health and Family Welfare and the Department of School Education, and in the light of seriousness of the infections spread and the escalating number of cases. Sara further requested the school authorities to consider implementing online classes to ensure that students can continue their education while maintaining their safety. With that, we come to the end of the morning news. Have a nice day.